Hi. Okay, tonight we're talking about the cruise. Okay, and the cruise is coming up. It's like 5 short months away, but it's coming up quick. We only have about 40 spots left to get in there. And the way the cruise is laid out, you have so many to get the cruise ship, and then we have a maximum. So if we cross this next 40 people barrier, then we have to get 150 people. Okay, more. But this one here, we're going to talk about the cruise, but also what we're going to be learning at. When we're at sea, we're going to be teaching, and I was talking to a bunch of people, and I'm super excited about what we're going to learn. Okay, we're going to cover what we're going to learn, and everyone else is saying, it's vacation. You got to talk about what you're going to be doing. So I think it's a good idea. So when you look at it, we're going to leave Saturday, come back Saturday, and this is February 2015, which sounds like a lot far away, but it's coming up quick. We leave out of Miami. So imagine if you got into Miami early. What would you do? Okay, I already got some ideas. Okay, then at sea, that's when we're going to start teaching, and I'm going to cover what we're going to cover. Then we go to Puerto Rico. Okay, and this is, they've got a lot of stuff going on in Puerto Rico. Then we go to St. Maarten, St. Thomas, and then we're at sea on Thursday, at sea on Friday, and then we're back home in Miami on the next Saturday. So it's Saturday to Saturday. And we're sailing on Celebrity Cruise Lines. What we're going to be covering, it's a 12-hour program. We're going to be covering anatomy and physiology for just a regular person. Because a lot of people don't know what spleens do. You don't know what kidneys do. When we did our series on thyroid and adrenal glands, you start to find out that everything's interconnected. So many people are coming up and they say, oh, I got this IT band firing off. No. Muscles don't work on their own. Okay. Dizziness doesn't just happen. Asthma isn't just there. So lungs don't malfunction. So we're going to talk about how everything is interconnected. And then we're going to talk about the body regenerates. So if there's a skin issue, a spleen issue, a thyroid issue. And we're going to talk about how organ systems, even if there's a part there, it still can work and regenerate. If you're missing an ovary, the other one works twice as hard. If you're missing a kidney, the other one works twice as hard. And so we're going to explain how the regulatory mechanism of the body actually is redundant. I mean, it's actually a really brilliant system. And then you're going to learn about some toxicities too that are happening. You're going to find out how your body literally turns food into you. And this is why there's also an energy or a spiritual aspect to what you eat and how you eat and why you eat. This is also why you're going to look at some of the toxins that we have in our systems. And, they're still giving out fluoride pills for dental stuff. I just learned that. Okay, now, when we talk about this, we learned that the fluoride actually was used in the concentration camps and, slows down the thyroid function. So there's a lot of things like vaccinations, genetically modified foods. There's a lot of toxins that people don't know about. And we're going to have booklets to give out that are going to have everything. We're also going to learn about how to change and rewire your brain, okay, to get your mental focus. Because if you believe that disease actually exists, how many people in here take your blood pressure every morning? No. Nobody? Nobody?
Oh, once a month.
Yeah. Why would you?
Why would you?
Okay. Does blood pressure go up and down?
Yes.
Of course it does. So think of the mindset there. Okay. I'm going to check to see if my body's malfunctioning. One of the things you're going to learn on the cruise is the body functions correctly no matter what, depending on the circumstances that it's in. So this is going to be a total mindset change into strengthening no more victim status, but a noble status of how your body actually works. Now, we're going to introduce the new healthcare model, and I did this on a health talk a while ago, but this is what has to change. See, right now, currently, we have the sickest country in the world. And now here, we're in Orange County. It's 2014. I get an Orange County housewife coming in from Newport Beach, which is, pretty nice area. Panic is all written over her face. How do I protect my kids from Ebola? I said, well, I wanted to say, don't have them, go and, share toothbrushes with infected people in West Africa, But she was seriously panicked at this. And so I'm thinking, well, because this is part of the crazy world, because they're inspiring a victim mentality, they're inspiring fear. And so I said, well, in some of the poorest countries of the world, the ones that have virtually no infrastructure, no fresh water, no sewage system, no refrigeration, okay, virtually no health care, and they have a 55% survival rate of everyone infected. And it's not even infecting everyone, it's infecting a very small portion. 55% survival rate. And this is with no care. So I told this panicked mom, I said, make sure that they eat healthy food, make sure that they get their nervous system checked, make sure they sleep correctly, give them some vitamin D3 since it's deep into October and it's only a little bit of sun outside, and they'll be fine. Okay, so let's look. I'm going to do a talk on Ebola. Okay, so we're going to learn, how to really panic a population on a genetically modified virus and how to sell a vaccine to people that's toxic and cancer causing. But anyway, the new healthcare model, and this is going to be what's ingrained in people. There's an innate intelligence in the body. I know, that's it. But now think of that. If people realized that there was an innate inborn intelligence in the body, would you check your blood pressure every morning? No, the body's going to make it go up or down. If you got toxic, thick blood, what's going to happen? Blood pressure is going to go up. If you got damaged arteries, blood pressure is going to go up. If you have clean arteries, blood pressure is going to go down. If you're breathing correctly, blood pressure is going to go down. If you're not breathing correctly, it's going to go up. So you respect the innate inborn intelligence of the body. Now, health is the natural state of the body. That would be ideal. So instead of going to a doctor and saying, your aunt had diabetes, I'm really worried about that, you should start taking metformin, you don't know. Okay, you start thinking, well, no, health is the natural state of my body. My body has an innate intelligence. You're talking fear. That's ridiculous. You're an antiquated healthcare system that was responsible for most of the deaths in America. All therapies must be in harmony with functions of the body. Again, this sounds like ridiculously common sense, but is this practiced today? So does this mean that if you have a tumor that's growing abnormally, do you destroy all the cells of the body using a toxic chemical developed in World War II and call it chemotherapy, or do you strengthen the immune system? I know. I just saw a commercial where they had this fireman holding little Billy's hand who recovered from leukemia, but now he has brain cancer from the therapy. Please help us to find good cures for the secondary cancer that we caused in the first place. No, none of this stuff makes sense. You don't give a toxic chemical like a blood pressure or cholesterol drug that increases dementia, diabetes, and cancer. That's what cholesterol drugs do, but it reads better on the blood test. So every therapy you do must be in harmony with the functions of the body. Vaccinations will stop until long-term independent research is complete. Now, I'm not against vaccines. I'm pro safe, effective vaccines. But now to be safe and effective, should there be a long-term study comparing people that got vaccinations with those that didn't?
Yes.
Okay? If the vaccine is toxic or medical therapy is toxic, should the company that makes that medical therapy or intervention be financially responsible?
Yes.
I would think so too. Okay? That's not how it is. Okay? In fact, now they don't do tests comparing a vaccine. They compare vaccinated with unvaccinated with a vaccine whose outcome is already known. So they're comparing vaccinated with vaccinated. The rationale is that it's unethical because vaccines always work. It's fine. It's unethical to test an uneducated or unvaccinated population because, it wiped out polio, it wiped out smallpox. And with all our talks, you understand that it never did wipe out smallpox, it never did wipe out polio. In fact, there's about 2,500 cases a year of polio in America. And all of them are caused from the shot. There hasn't been a wild case of polio in about 65 years in America. Why do our kids get 5 shots? Why is the Indian government taking the Bill and Melinda Gates Foundation to court? Because right now there's about 62,000 kids that are paralyzed from the polio shot. You know what they're saying? Hey, 62,000 kids is better than 1 million having polio. And I'm going, yeah, if we're crunching the numbers, not bad, but let's look at how many people had polio before you started the shot. Do you know how many people had polio before you started the shot? No. It was about 1,000. It comes from neurotoxins and unsanitary living conditions. So is giving a shot cleaning up the water supply and helping the food supply? No. So then we're getting a negative response to it. So, it just requires intelligence. So vaccinations will stop until long-term research, because I don't want to see somebody preventing chickenpox but developing cancer. Okay? Medical schools will no longer accept funding or research from the pharmaceutical industry. Man, again, I'm liking this. This makes a lot of common sense. So this means that since health is a natural state, the medical doctors will be using approaches to find the source of disease, not doing a symptom. So instead of memorizing or regurgitating, okay, which means you get a group of symptoms and then you put it in a category and you prescribe a medication, and if the patient dies or contracts another disease, you can't be sued because you're following the standards of care or the protocols. Okay, that's insane. I mean, I should have told this mother from Orange County about Ebola. I said, well, there's 106,000 people every year dying from the right drug at the right time for the right diagnosis, okay, and the right dosage. In this country, only America. There's something not right. Did you get that? Okay, just checking. Yeah. Okay, but when you look at this, since December 2013, there have been about 7,100 infections from Ebola in the entire world. I'm sorry, 106,000 people a year die from the right drug at the right time and the right dosage for the right condition. Okay, every year, that's a jumbo jet crashing every year. Since December 2013, there have been 7,000 cases of Ebola. Now, I'm not saying that it's not dangerous, but there's been about 3,300 deaths, so it's about 55% survival rate with virtually no care. Okay, so the medical schools will no longer be funded by the pharmaceutical industry. Okay, they're going to actually have to do independent research because they're going to follow the first parts of this. They're going to follow that the body has an innate intelligence, so they're not going to look for disease. You're not going to go to a poor area that has a depressed economy to ask for financial advice. Excuse me, you're pushing a shopping cart. What investments do you do? Yeah. Okay, so all healthcare research will be independent. Currently, the people that make the drugs or therapies pay for the research. So if you run a research company and you're getting paid by the guy who's producing the drug, are you going to maybe fudge the data a little bit? Yeah, you can do a thing called active placebos, which has been around for 15 years, which has completely invalidated the so-called scientific database. We're science-based. Yeah, right. Not anymore, not for the last 15 years. Okay. And then you look, the pharmaceutical industry will be financially and morally responsible for their products. 60-some thousand men died in the Vietnam War, all the years we were over there. That's, we're talking years. Every year, just for the right drug, 106,000 people die. No one is going to jail. No one is saying, look, these drugs are bad. I just had a patient. Now, if you ever want like to do research, look up Actos. It's a drug used for diabetes. It's paid $9 billion in fines for falsifying data and research. It's killed thousands and thousands of people. And when you look at this, it's still on the market. Wow. I thought it was pulled off. Okay, and I had a patient last week that was taking it. And it was just like, wait a second, you can't be taking this stuff. This is pulled off. And they said, no, my doctor prescribed it. And I said, okay, Google Actos damage. Actos problem. You're going to see a $9 billion lawsuit. Now, they paid out $9 billion. Is it still financially viable to produce the drug? Sure. Yeah, they're still making billions on top of it. So, you're not going to make an omelet without breaking some eggs. Wait, but think of that. Financially and morally responsible. I mean, they used to say the most hated person in America was the cigarette or tobacco rep or tobacco lobbyist. Okay, so I encourage everyone, including everyone on YouTube, to watch Thank You for Smoking. Has anyone seen that in here yet?
Oh, yes, I have.
Absolutely exceptional.
Absolutely.
Thank You for Smoking. I recommend it. Okay, all humans will be able to choose any healthcare procedures. None will be forced on them. I don't know. Should I be responsible for anyone that's going to rape or beat me? Should I have the choice in that? Should I say no? I'd rather not be raped or beaten. That I have sovereignty over my own body. Do you think that should be like minimum requirement? I mean, just to be a human being. That we should be able to choose? Well, the Supreme Court actually said that interpreting the U.S. Constitution that we had the right to choose or not choose any therapy we want. Well, the FDA, and this was Rutherford versus United States, it was about cancer therapy. The FDA, the Food and Drug Administration, stepped in and said, no, we can't have snake oil salesmen on the corners. We're the only ones that are smart enough. You're not smart enough to choose your own therapy. You don't have sanctity over your own body. Okay, bam. So that right was taken away. But now we've got hundreds of nurses, dozens of doctors, so it shows who's smarter there, as patients. I love you, nurses. You rock, baby. Okay, but when you look at this, are they being forced to get vaccinated? Yeah, only since 2010. Okay, and the requirements are getting more and more and more, so sometimes it's not that you're working with patients or you're around patients. Now they're getting the office workers. So you want to get a paycheck, you get shot. You don't, punitive, we're going to put a mask on you. Okay, now this is interesting because does getting a vaccine make you less of a carrier?
No.
No, it wasn't designed for that. Does it make you less infectious? No, in fact, if you get the spray in your nose, you actually shed a living virus for 2 weeks. Okay, that's pretty stupid. Okay, so now does the antibodies you produce protect those around you? No, the herd immunity stuff is all false. That's insane. And now the mask that you wear, okay, if you're not going to get the shot, does that prevent transmission? No, it actually, multiple studies show that it doesn't. So there's no science data behind it. And you should have sanctity of your own body. No, I'd prefer not to have the monkey proteins or caterpillar larvae or the dog kidney proteins or the aborted human fetal cells or the chicken, which are your 4 different types of flu shot this year. You can choose the monkey kidney, the dog kidney, the aborted human fetal cells, the caterpillar larvae, or good old-fashioned chicken eggs. Okay, and those are the growth medium. Granted, the 4 of them, the monkey, the aborted human fetal cells, and the dog kidney, actually 3 of those are all immortal cell lines or cancer-causing cell lines. So they're forcing you to inject a flu shot containing cancer-causing cells, and the FDA on our flu shot talks about how they say, yeah, the recipient can develop cancer from these shots, but it gives us a much more consistent product. So now, currently today, you're forced to get a cancer-causing shot that's shown to be ineffective in order to collect a paycheck because you don't have sovereignty of your own body. So number 8 is important. Okay, so this is what we're going to cover on the cruise. Now, what's neat is Miami, Florida. I don't know about you. I've never been. I've never been on a big boat before. I've only sailed like a 56-foot boat to the islands out here. This thing is massive. I think of Miami, I think of cigars, I think of, mimosas, I think of the beach, okay? I'm going to get there early, I'm going to go on a bike ride, I'm going to check what the town is like, because I like bike riding. I just think it's cool. But what they've got, bike riding, beaches, rent, I'm in there typing out, what kind of fun stuff can you do? And Dr. DeWitt, he's back there, dude, the nightlife is so good. I'm asleep by 9:30, My nightlife is, you know, the bike. But swimming, shops, I mean, it is. It's called the Gateway to Latin America, but this is where we're going to leave out of Saturday. Then, when we're on, so after we leave Miami, we've got 4 hours of lecturing on the boat. And that's what we're going to talk about, health, dynamic, everything, okay? And also on the boat, we're going to cover that. There's actually have some restaurants on the boat. They have some gambling on the boat, okay? Not a big gambler, but I do like the restaurants, okay? They have pools on the boat. They've got different activity. They've got exercise. They've got a cool gym. You could rent everything on the boat, so it's kind of cool. Then we hit San Juan. Now, when I hear of San Juan, do you think of pirate forts? Or is that just the kid in me? Okay, the girls don't, but I'm thinking of pirate forts. You do? Okay, cool. I mean, this is just going to be fun. But they also they've got Indian caves back, hundreds of years ago that you can climb down. Kayaking around it. I mean, shops, okay? My sister will like the shops, but it just seems like fun, okay? And then they have a rainforest. Imagine touring a rainforest on San Juan on an ATV. It doesn't get much better, okay? So then we get back on the boat, and then we head over to St. Maarten. And you start looking at this, St. Maarten, this is pretty cool. Okay, it's been owned by the Dutch, and I love this, a dash of Paris with a splash of Dutch. It's been owned by the French and Dutch for 350 years. I'm from Huntington Beach. There's nothing here there's an oil well that's 50 years old. Everything else is like, So you go to this place, you're going to look at old architecture, you're going to look at old forts, but they also have boat tours around the island that show you spots where pirates were. Again, I'm 54-year-old teenager. So I'm thinking pirate boat tours, the snorkeling, jet ski rentals. Oh my gosh. That's going to be a blast. You can rent sailboats, or they have like catamaran tours and sailboat tours, which if you've never been on a sailboat, this is a blast. I mean, to be powered by the wind you fly at 7 miles an hour. Okay, I know, my kids think, yeah, Dad, it's not that fun. No, it's really fun. Okay, then Segway tours, swimming, and again, shopping. I don't know. Okay, now this is something, then the next stop, okay, so we had 3 islands, 3 different days. We go to St. Thomas. Now, St. Thomas, when you're looking up St. Thomas, it's gorgeous, gorgeous. It's got some of the best beaches in the world, and you can get to them from land or sea. They have something I've never heard of. It's called a BOSS, Breathing Observation Submersible Scooter. Can anyone say James Bond? Okay, you put this bubble on your head, you get on this thing, and you drive it underneath the water, underneath the waves. Oh, that right there would be worth the trip. Okay, good. You get to learn about healthcare and how to keep your health and how to have a mindset to change. Dude. And then Blackbeard's Castle, Bluebeard's. I mean, this is where the actual pirates who worked for the British government, okay, partly, they stole Spanish and French. I mean, this is incredible. I mean, I can hardly wait. I mean, this is going to be a blast. And then, of course, snorkeling. And I mean, you can go snorkeling off the coast here. But one of the reasons we picked the Eastern Caribbean is because we got a tremendous amount of people coming from Europe. So it's about, 3,500 miles from Europe. It's about 3,500 miles from us. So, it's kind of in the middle, kind of. Okay, and this is what we're going to be talking about. I mean, everybody's going to have videotapes. You're going to have books. You're going to find out why the population is so sick, because the group that's there, that's learning that 12 hours, okay, granted, we're also going to be exploring. We're going to be hanging out. It's just going to be a blast. But you're going to be empowered. If somebody says, are you getting a flu shot? You're not going to see a wimpy thing like, I don't believe in that. No, it's not a religious procedure. There shouldn't be a belief system attached to it. You say, no, it has cancer-causing ingredients and it's not effective. Why would I choose to have something like that and inject it into my, sovereign intelligent, brilliant, innate body. You know, that's foolishness. You know, and it's, you're using science. So we're going to talk about the basic aspects: food, elimination, movement, social and mental health. We're going to talk about the mindset, how you can literally think yourself sick and think yourself healthy. But we're going to show you exercises. You're actually going to have a workbook of exercises to change your mind, to change tissue regeneration. I mean, just fantastic. And we're going to talk about the people that weren't on the cruise, the rest of America. Okay, I know, the ones that are in deep trouble, okay? Because when we get off of this cruise, we're going to be 200 empowered people, okay, that understand that, my gosh, we can open up ourselves and explore Blackbeard's castle, okay, and also come back armed with all this knowledge, and we're suntan, healthy, we got vitamin D, we're relaxing, we're renewed, we're regenerated. Oh my gosh. And then we're going to come in and we're going to see, wow, every third person that's in that Miami thing has got heart disease or cancer or high blood pressure or diabetes. No, you guys are missing the big picture. Health is the natural state. There's an innate intelligence in the body. No, the medical schools are no longer funded by the pharmaceutical industry, and those guys are taking responsibility for their product. No, you don't have to get any injections in your body. You have sanctity over what happens to you. No one's going to come in and rape you without your permission, okay? So it's going to be healthy. And you look at this, you think high cholesterol? That's not a disease. That's how the body adapts to it. You're going to be empowered. You're going to find out this Western pandemic of diseases. You know, we're talking about 7,000 people that got a disease called Ebola over just about the last year. Okay, and and everybody's missing the major pandemic of diseases of Alzheimer's, Parkinson's, dementia. We're going to show how to regenerate the nerve cells in the brain. We're going to show what causes this stuff. Autism, bipolar disorder. If you saw, I mean, the cutest little kid, 6-year-old boy, comes in today bouncing around. He comes in the back in the kids' area, you know, throwing stuffed animals around and banging stuff around. He's just showing how he can do, you know, the arm farts that kids do? Okay. He's in there, he's saying, "Doc, check this out. I can do it with my leg." Okay, and he's running around. He came in with attention deficit disorder. They were going to put him on drugs. Okay, he didn't have attention deficit disorder. He had pressure on the brain stem, okay, that was causing ear infections when he was growing up. They gave him antibiotics that destroyed his normal flora. So he had leaky gut. He had a swollen abdomen. He was allergic to a lot of different foods. We got him off everything. And his mom, he's been in school now a month and a half. His mom still says, "You know, the teacher says he's still okay." I said, "Mom, don't wait. You know, that the bomb isn't going to drop. He's going to be okay the rest of his life. You know, he's a high energy kid, so he knows to play here because this is fun, and to pay attention in school, and, you know, do this on the parking lot, you know, or the playground." And so when you look at this, I mean, just the basic stuff. You're going to come back so armed from this cruise. You're going to learn that epigenetics, the control above the genes, is more important. When we're biking, okay, around St. Maarten, or Segway tours. Has anyone ever ridden a Segway? Mm-hmm. They're really fun. Okay, you can jump them, okay? Me and my two boys, wait, I don't know if the person that we rented them from is going to watch this. Okay, you can jump them, I've heard. But they're really fun. Yeah, my oldest boy crashed it, but it's really kind of cool. But so when you look at this, there's a control above the genes. People don't know that. I mean, they're getting healthy body parts lopped off because somebody told them, a victim mentality, that there's no innate intelligence in you and you're a victim of your genes, and that your uncle had breast cancer, you're going to get breast cancer, and your aunt had prostate cancer. And no, I guess ants can't, well, actually in this culture. No, but when you look at it, I mean, it's so simple to realize that your mind controls gene expression. If your mind can control the expression of the gene, this means you can express cancer or suppress it. You can express susceptibility to Ebola, or you can suppress it. Yes, it's not the germs that cause disease. It's the weakening immune system. I mean, this has been known for a couple hundred years. We're going to talk about how structure equals function. Some of the tapes I've got for the lecture, and we're going to do another review of this, you're going to see that this is a normal side view of the neck, and this thing goes forward. You're going to see the massive structures if that head is forward or there's a loss of curve in the neck, how it pulls on the brain stem. Because a lot of people will say, no, that can't affect the cranial nerves. We just had a patient, actually started the beginning of this week, that was yesterday. She's got one eye that's looking in like this. Okay, it's called strabismus. And that's from a cranial nerve called lateral rectus. And her eye's like this, the other one's looking straight, and her head's like this. This actually, that forward head carriage pulls the area of the brain stem controlling the cranial nerves. And a lot of doctors will say, it can't be affecting that, the cranial nerves don't lose their head. Amen. But when you look at this, okay, and you look at the MRIs and the CT scans of forward head carriage when they're weight bearing, it does. And it can negatively affect dopamine production, everything. We're going to talk about how blood vessels, how the health of your blood, the health of the tubes that carry the oxygen and nutrients can actually affect your health. I mean, we're going to talk about stroke. Frontal lobe, we're going to talk about dementia and attention deficit disorder, all the diseases. We're going to talk about how to keep your insulin levels low. And that's one of the things, if you have type 2 diabetes, they give you a drug that lowers blood sugar, insulin levels remain high, you die early if you take metformin or glucophage. And we're going to teach you, because figure 1 in 3 Americans, when we get off that cruise, you're going to be chiropractors that don't practice. Okay, you're going to be healthcare practitioners because you're going to be so passionate. You've just experienced the rainforest from an ATV. You've dove in beautiful crystal clear water. You've walked on white sand beaches. You're going to glow with this knowledge. Okay, we're going to talk about how digestion works. You're going to know how all this stuff works. You're going to know that carbohydrate digestion begins in the mouth. You're going to know where protein is. You're going to know if somebody has mineral deficiencies, if they've got dark circles under their eyes, if they've got lines on their fingernails. You're going to go in there and you're going to say, by gosh, you got to do a fungal test. I know we can help you. Here, check out this video. No, we'll get you healthy. No, it's going to be fun. This is why we call it to renew and regenerate. You're going to find out that thyroids, even if they've been blasted with radiation, nobody lives 18 months without a thyroid. Okay, you got to have some kind of thyroid function. Okay, we can renew it. You're going to find out how depression and anxiety is a result of how the brain is currently wired. You're going to learn how to rewire it. And if you've been in pain for a week, do you think the wiring in your brain starts to change?
Yes.
It does, because it becomes familiar. What if you've been in pain for 5 years? What if you've been in pain for 30 years? You start to lose the ability to realize that this can be recovered. So we're going to show you how to regenerate that and to change the wiring in your brain. This one here, just laying hands on a carcinogenic mouse, even if you didn't believe it, recovered the mouse. And I love his saying, we may conclude that we apparently are able to cure mammary adenocarcinoma in experimental mice on demand. On demand. How can he do that to a mice? How can he just hold it? I demand the cancer go. And it goes. Consistently.
You're a celestial being.
Oh, now you're talking about we're more energy than matter? I know, we're going to talk about that on the cruise. Okay. So think of it. I mean, okay, granted, if you're thinking about the other stuff, you would put shops up here, okay, and restaurants. I'm putting Blackbeard Castle and pirate tours. I just think that's totally cool. The breathing observation submarine scooter, come on, that or shopping. But you can still go shopping, it's okay. Okay, you know, it's just, we're going to be studying on the sea. We're going to be playing on the boat. We're going to be diving in the ocean. We're going to be, white sand beaches. And it's called eventslifejourneys.net/Dr. Bergman Caribbean. We're going to have links on the bottom of this video. We're going to have links everywhere to get it. But on the boat itself, now this boat to me is intimidating as all heck. I've sailed something 50 feet long. This is hundreds hundreds of feet, okay? But they have restaurant, clubs, pools, casinos, okay? I mean, just observation decks. I mean, everything fun. When you look at this, you're literally going to relax. I mean, I'm going to be on there reading, studying, going to the pool. I mean, just there's so many things to do on board, and it's all covered. I love that. And so this one is actually Celebrity Cruise Lines was named one of the best cruise lines in the world. The beaches are some of the best in the world, and it's close. Okay. And this right here, this is my favorite handout. We're going to renew, restore, and regenerate, because anything you do that optimizes health, is direct sunlight and having fun going to help you?
Oh, yeah.
Yeah. Is darkness in the wintertime around February going to make you sick? Yeah. We go to the Caribbean to get healthy. Okay. Does that make sense? Okay, now, next week we're going to be talking about breast health, thermography, because this is breast scare month. I mean, breast health, breast
Just awareness.
scare, breast cancer awareness month. Okay, yeah, she's going to talk about the difference between thermography and mammography. Okay, don't get a mammogram. And then this Thursday I'm talking at the Living Temple on the nervous system and how that works. Thank you very much. See you on the cruise.